So everything's intertwined around healthcare. That's just one kind of, and I expressed this to the committee, by the way, last week. You know, everyone wants to work on the symptoms rather than working on the disease, right? And that's an example of wanting to work on a symptom rather than working on the disease. Whether it's the 2,400-page bill that passed the House and was being debated in the Senate, the President's new proposal that was released last Wednesday, the real problem I have with virtually everything I see and hear that's coming either out of Washington or even in Hartford. I sit on, by the way, the Governor's task force. I also sit as an ex-official on the Substantive Committee. The real problem I have is none of these policies really address a root cause. And the root cause of what's really confounding our healthcare system is the fact that, and I see it in every great file that comes in my door, there's incredible cost escalation in the delivery of care. So unless and until we deal with how we're delivering medical care to our residents and to the nation as a whole, and we deal with the price pressures around delivering care, we're never going to reform healthcare. We can have insurance market reforms, we can try and fix some of the symptoms, but we're never going to get at the root cause of the disease. And, this is, by the way, much easier said than constructing a policy, right? If someone had the silver bullet to what I just proposed, that would have been shot out of the gun a long time ago. It hasn't, because this is a decade-long problem that's confronted our state and our nation. And so unless and until we get to the point that we're ready to deal with cost, and quite frankly, by the way, the biggest payer, right, of health insurance is not, Aetna, WellPoint, United Healthcare. It's the federal government, right? So the federal government, through Medicare, Medicaid, and all the other social programs that they administer and or subsidize through state governments, pays over 60% of the lost dollars that are absorbed in our healthcare delivery system, right? So 6 out of every $10, the payer is the federal government. It's not a private health insurer, all right? So we operate today in an environment where you've heard this fee for service, right? So providers, doctors, hospitals, medical professionals get paid every time you walk through the door. They don't get paid whether or not they make you healthy, whether they cure your cancer, whether they, you're better off today than you were yesterday, right? You guys all get paid, by the way, whether or not you produce the next policy, whether or not you place coverage, whether or not you're successful in running your business, right? The medical community gets paid totally on volume, right? It's all on how many times we treat the patient. And so unless and until we deal with a fee-for-service environment, think about how revolutionary this would be. If I took a doctor and I said, I'm giving you 1,000 patients on January 1st, and we're going to baseline and benchmark all 1,000 of your patients in terms of whether or not they're overweight. We'll do BMI body mass indexes. We'll see if they have any diabetic tendencies. We'll see if their blood pressure is normal. We'll see it, depending upon where they are, age, other categories, we'll find out what their level of healthiness is or not, right? And then on December 31st, I'll say to that same doctor, you've treated that population of 1,000 people over the year, and in the areas where you could influence healthy behaviors and or get them healthy, which is your job as a doctor, you made them healthier. So consequently, I'm going to pay you X because you did your job. Conversely, if you have a practitioner who doesn't do that, you pay them something less than X, right? What do you think would happen to the medical community if that was the behavior? Instead of an environment which today rewards practitioners for, oh, I saw you today, I got to see you again next week. Or, I want to order another X-ray because I'm afraid of litigation. I would submit to you that it would. And I get back to my original point around healthcare reform. Unless and until we deal with the fee-for-service environment, we're not going to have true reform. I don't care if it's in a 2,400-page bill. I don't care if it's in a 2-page bill, right? That is the crux of how we're going to solve healthcare. And again, a lot easier said than done, but just my perspective from the perch that I sit on. Right? Thank you. And by the way, I could go on my, we don't need to centralize more power in Washington rant, but I'll save that for, you can turn on news channels and get that same kind of opinion. But I wanted to talk a little bit about, now I'll put my black cape and our Grim Reaper outfit on, some of the concerns confronting our state. We have long-term debt obligations confronting this state that are second to none. We today, these are from, some of these numbers are from OPM and they're a month or two old, so they're probably bigger than what I'm about to cite you. Connecticut's long-term debt obligation is roughly $62 billion. That's up 7% from last year. So our debt's increasing. That equates, by the way, for every one of you sitting here at lunch, to roughly $18,000 for every man, woman, and child in the state of Connecticut. You own $18,000 of the state's debt right now. Our bond rating's been cut by Moody's and Fitch, due in large part to debt financing in order to balance our budget. We effectively bonded last year $2 billion to solve the current year's budget crisis. We have unfunded pension obligations in the teacher retirement fund of over $6 billion. The state employees retirement fund is underfunded by $9 billion. Deficits based on the current enacted state budget will be unprecedented and likely, this is again by the Governor's Council, extend into fiscal year 13 and 14. The use of one-time revenues, by the way we balance the current year's budget, we operate the state of Connecticut on a $19 billion, effectively costs $19 billion to run the state of Connecticut annually. We effectively balance the budget with $5 billion of non-recurring revenues. The $2 billion in bonding that I talked to you about a minute ago. We've got $1.5 billion of stimulus from good old Washington. And then we rated the rainy day fund of $1.3 billion. So on a $19 billion budget, there's $5 billion that this state will never see again. Good luck to the General Assembly next year. Good luck to the next governor, whoever he or she is. Because the crisis is real, and the effects of kicking the can down the road over the last few years have now reared their ugly head. I share all this with you because you need to know it, right? Many of you are small business owners or in small businesses, and you need to be aware of it because the fiscal crisis impacts every one of you. And you need your voices to be heard in Hartford, and we need long-term solutions to the problems that confront our states. We cannot proceed in a manner that deals with the budget incrementally year after year. Okay? Functionally, we have to change and reform how we deliver state services. And I'm anxious to see what the next elected leaders have for proposals on how we do that. Again, speaking of no silver bullets, I doubt there's a silver bullet to everything I just dumped on you.